I've started it, but like I said, we're just having a conversation.
Okay.
And you just tell me your experience with TMJ issues and how you came to us.
Okay. Well, I started having horrible problems after about a year of dental work. Way back, and this sounds like a long time ago now, on October of 2017. And the dentist I was seeing then was trying to work on my back molar, and we all heard the crack of my TMJ on the left. And I will never forget it because it hurt so badly. And they all heard it and they didn't seem to think anything of it, but I kept on hurting and I kept telling them that, and nobody would do anything. So at this point, I'm on my 5th mouth guard, but let me tell you what happened in between. I kept going from one dentist to another dentist, and they would say they were specialists in TMJ problems. I am never going to be a drug-taking person. I'm allergic to just about every drug there is. So I found that out when I had a total knee replacement. And I just am not a drug person. I don't like to take drugs. There's got to be another way to do this. So I kept getting fitted with all these mouth guards. Well, one of the main things I did was I went to one of our esteemed universities to the orofacial pain specialist, and I have never hurt so bad in my life. My sister went with me, and they had to put shots in my jaw, both sides. It hurt so bad just to get my mouth open enough so that they could put that gross gunk they put in there to make this horrible mouth guard, which every time I tried to put it in, I could barely get my jaw open. And then when I put it in, my teeth were moving so badly. I went back 6 times to get it adjusted. Her idea of adjusting it was to also give me one Flexeril, which is an anti-spasmodic, also it's a skeletal muscle relaxant, to give me 1 Flexeril in the morning and 2 Flexeril at night. Well, you cannot function, you can't drive, you can't do anything. So on top of the migraines I was having, which I am a family nurse practitioner, and I am so thankful that I was so nice to my migraine patients, because I found out you cannot function when you have a migraine. A headache is one thing, a migraine is totally different. You can't see, you're hearing, you can't stand to hear loud noises, you can't stand to see light. You're literally in your bed, lying down, putting a cold cloth on your face, head, trying to do anything you can to get better. So this is what I suffered with starting October of 2017, all the way through seeing all these specialists, until one day my mother had somebody, my sweet mother who's 92, had somebody come to visit her from Meredith College to bring her a book, and she was telling them that her daughter Claire, because they asked about me because I went to Meredith before I went to Carolina to be a nurse, they wanted to know how I was doing, and she said, my daughter has this problem with her jaw, and it hurts her so bad. And she goes, is it TMJ? And Mama said, yeah, something like that. She said, I've got the perfect person for you, Dr. Weaver. I looked at that as an answer to prayer, because believe me, I was laying there praying so many times, please, Lord, there's got to be something else. So I came here. I'm trying to remember. I think it was, I had it in my notes. I think the first time I saw him was in November for an evaluation. And then in the next week, of course, I almost had another heart attack, because I have literally pulled money out of my IRA, which my 3 wonderful children are never going to see in their inheritance, but they're so sweet. They go, Mama, just get to feeling better. We want our crazy mama back. So with Dr. Weaver, they got their crazy mama back. But my jaw was so bad. And even Dr. Weaver, he just said, oh my gosh, you can barely get your mouth open. And I told him about the migraines, how it had incapacitated me. By the time I'd had, well, this little box, this is worth every penny, this Alpha Stem microcurrent machine. He was kind of really surprised after I got it and how much I used it the first week, because I showed him it has the number of hours you use it on there. He went, you're supposed to use it 1 hour in the morning and 1 hour at night. Well, I'd used it about 6 hours a day, but it kept me from getting a migraine. I can stand a headache. I knew I was going to have jaw pain because of what happened to me, but this thing will keep me from having a migraine. So I have been since the very end of December all the way to now, which is, what is today, the April, I don't have my phone to look at it, but I think that April 25th. And I have been able to stop every migraine using this little machine. Also, obviously the talent of Dr. Weaver, he is so patient, and I know Susan does all the massage and that sort of stuff. I had no idea I had, well, I had a lot of trigger points, let's just put it that way. Everywhere you touched on my face, my head, my neck, it killed me. So, but he explained to me it was just because I had been in pain and having migraines for so long. So, about the time all this happened and I stopped having the migraines is when my mother fell out at church. And my sweet 92-year-old mother, see, I was able to drive her around, drive her to doctor's appointments. I would not have been able to do this otherwise. I can do it with a headache and a jaw ache. You cannot do it with a migraine. So that was also a family thing that really helped. But Dr. Weaver really believes in this program, and I do too, because he's very patient. He waits, and then he looks, and he's had to do a lot of refitting my teeth to make my bite correct, and that is what has really helped. So I can get my jaw open a little bit now, and I can smile, and I'm a totally different person from when I came here, because I was hurting so bad. My sister had to drag me here, literally, and she drove like a maniac to get me here. But anyway, Dr. Weaver has been so nice, and this is such a wonderful, nice, balanced, to keep me from grinding my teeth, because when you hurt, you grind your teeth, compared to this piece of junk that I had in my mouth. So, he believes in his program. He's thought it through. It is a wonderful program. I know everybody gets shocked at the money, but if they only knew all the money I had spent on 5 other dentists, and this is my 5th mouth guard. I'll take this mouth guard over anything, and nobody ever better steal it, because I will come after them. So I'm very thankful for Dr. Weaver and the program, and I'm so thankful that I can stop my migraines. I know I have a long way to go because of the jaw problem, but I can live with that. And I'm just thankful to have this treatment program, because it's the only treatment program. Everything else is give you meds, you know, just fit her with this, let her go, and nothing else is spoken of. So this is an actual treatment program, and I fully encourage anybody who's having migraines or severe jaw pain like I have to try it out.